WHO Europe says it's deeply worried about rising case numbers on the continent. It projects a further 236,000 COVID-19 related deaths in Europe by December 1st. The WHO Regional Director for Europe is now recommending booster shots to protect the most vulnerable against the coronavirus. And he now joins us live here on Euronews Tonight, Dr. Hans Kluge, the WHO Europe Regional Director. Thank you so much there, Dr. Kluge, for joining us. I want to ask you, just last week, we heard from the Director General of WHO calling for a 2-month halt to booster shots. And now you're saying that you're recommending them. So what is it?
So I would like to put some nuances here, Per. So the top priority is to ensure that people, the most vulnerable, get the first and the second jab, right? Then we have to do it all, meaning in those countries where we see that the people with decreased immunity, the elderly people, have a waning immunity against severe disease and death, those countries can consider a third dose. But we should do it all. It means to share doses with those countries which still did vaccinate fully their healthcare workers, and at the same time, look at the evolving evidence. So do it all.
But can you do it all? I mean, you guys at the WHO, you always talk about vaccine injustice, these poor countries who actually don't have access to these vaccines. Can you recommend a third shot while at the same time telling countries, no, you should send jabs to the other countries?
So what we see in the WHO European region, Per, is that for the last 6 weeks, there is a plateauing in 18 countries. In fact, in 15 countries, there is a decrease in vaccination uptake, even when the vaccines are available. So we have to work on multiple fronts, and one of that is to decrease the vaccine hesitancy.
So I'm sorry, but if you've got countries where you have a decreased vaccine uptake, I mean, are you saying that those countries should send their jabs to the poor countries? Or how do you get this math working with poor countries needing the first vaccine jab while at the same time countries giving a third dose?
We know in the pan-European region, for example, that there are at least 28 countries which have a surplus of doses. So those doses needs to be shared as soon as possible with those countries which need the vaccines for a first and a second dose. And it's happening, but the pace is too slow. Sometimes countries wait a bit to share when the expiry date is too short. So that mechanism of sharing, uptake, and increased production has to be accelerated. Do it all.